Hello, my name is Arielle Tran.
And I'm Martin Garcia. We work in Dr. Kern's lab.
Along with being a distinguished cardiologist, here at Banner, Dr. Carl Kern is also the co-director of the UA Sarver Heart Center and chair of the Sarver Heart Center Resuscitation Research Group.
It's only natural that our lab focuses on cardiopulmonary resuscitation, or CPR, research targeted towards heart attacks, specifically and scientifically known as myocardial infarction.
The main research question our lab aims to answer is how can we better treat and improve outcomes in patients who experience a myocardial infarction?
Okay, it is this question that drives us to find novel interventions for myocardial infarctions. What we do in our lab is experiment on domestic swine models from two groups, hypothermic and normothermic.
The hypothermic group is cooled and the normothermic group is our control. The animals will undergo survival surgery where we will artificially induce a heart attack.
Afterwards, we will stain the heart and quantify using a program what regions are damaged, at risk, and healthy. In addition, we also collect hemodynamic data, evaluate our endpoint variables, and assess the animal for a neurological deficit. The purpose is to extend the survival rates of both in and out of hospital cardiac arrest. Following the onset of symptoms, the likelihood of survival for cardiac arrest patients actually diminishes.
It is vital to extend this small but crucial period of time as much as possible to minimize damages without compromising the condition of the patient further. Ultimately, cooling the body is a potential solution to give patients more time between the beginning of the symptoms until they can seek proper treatment in the hospital by limiting the amount of damage their heart incurs. We want to optimize resuscitation protocols for heart attacks.
My contributions to this lab are to gain percutaneous access to the artery and to the vein to allow us to manipulate the heart whenever we need. I also help to maintain equipment and materials for the lab for any endeavors that are for hypothermic or normothermic experiments.
My contribution to the lab is to actively participate and assist in scheduled surgeries and data analysis.
Some of the questions we have developed in working in Dr. Kern's lab are, is there any way to decrease the area at risk within a heart other than cooling down body temperature? And my second question is there any possibility of increasing the survival rate without decreasing the integrity of this research project?
Some of my questions are, will cooling the body limit myocardial damage to the heart? Another question I have is, what are the neuroprotective effects of therapeutic hypothermia? And finally, we would like to give a big thanks to the CPR lab.
First, we'd like to thank Dr. Kern for giving us an opportunity to work in this lab. Second, we'd like to thank Alice MacArthur for leading the way and being a leader throughout the research project through thick and thin. Lastly, we would like to thank David Ho, who's an amazing cameraman, an amazing mentor, and just an amazing person that knew how to explain things in a way that we could understand.